Bismillahirrahmanirrahim. I'm Dr. Mohibullah Wazir, and today we discuss the surfaces and borders of the heart. Look, this is the anterior or sternocostal surface. At this surface, you can see the right auricle, a small part of the left auricle, and then you can see the right ventricle and the left ventricle. And at this surface you can see this groove, anterior interventricular groove, which separates the right atrium, the right ventricle from the left ventricle, and lying in it you can see the anterior interventricular artery, a left anterior descending LAD artery. And then in the same surface you can see over here that there is a groove between the right atrium and right ventricle, and this groove contains the right coronary artery. And then you note the part over here. Look, the anterior sternocostal surface is covered by the lungs, but level with the third, the fourth and fifth intercostal space. In the left lung there is a cardiac notch or cardiac incisor, and over here in this area the heart is not covered with the lungs. That's why you can approach on the left side near the sternal border at the fourth and fifth intercostal space. Directly you can stab into the heart during emergency condition. And also you can put needle over here to drain the pericardial fluid at the left, fourth and fifth intercostal space near the sternal border. Alright, then you can see present at the anterior sternocostal surface over here, this is the apex of the heart, and the right or inferior border and the left border unite with one another at the apex of the heart, and which is formed by the left ventricle. And this apex of the heart, it lies over here in the left fifth intercostal space, level with the mid axillary line. The apex beat or apex of the heart, it lies in the left fifth intercostal space at the mid clavicular line. Okay, then this surface of the heart, look, this surface which rests upon the diaphragm, this is called as the inferior or diaphragmatic surface, and you can see it over here. This inferior or diaphragmatic surface, it rests upon the central white tendon of the diaphragm and slightly encroaching over here into the muscular part. And just inferior below to it lies the stomach. That's why if the stomach is overfull, it compresses over the heart. And this you can see, this is this inferior or diaphragmatic surface, and mostly formed by this left ventricle and slightly formed by this right ventricle. And over here you can see again a sulcus which separate the left and right ventricle from one another. And this sulcus contains over here the posterior descending or posterior interventricular artery. And on the same side over here you can see over here this sulcus, this big sulcus which separate the left atrium from the left ventricle, and it contains this big vein. Look, this is the coronary sinus, this big vein, and opening into this big vein from the left side you can see this is the great cardiac vein, and from the right side over here this is the small cardiac vein that opens into the coronary sinus. Okay, and then you can see the posterior surface. The posterior surface or base of the heart, which is formed by this left atrium, and also contributing to it you can see there are four pulmonary veins, and this you can see this is the inferior vena cava, and this you can see this is the superior vena cava. In this way, the most proximal ends of these four veins and these two big veins, it also contribute to formation of the posterior surface or base of the heart. And this posterior surface or base of the heart again is separated from this inferior surface by this coronary sulcus or coronary sulcus, which contains the coronary sinus. And this posterior surface or base of the heart, it lies over here upon the vertebral column, and it also lies upon, you can see over here, upon the lower bifurcating end of the trachea and esophagus and descending thoracic aorta and the thoracic vertebra 5 to 8, but in standing position it is from 6 to 9. And secondly, because these vessels enters into the heart from posterior side, that's why this part of the heart is relatively fixed to the posterior thoracic wall. Alright, then there is the right surface, a right pulmonary surface, and the left pulmonary surface. This you can see it over here again. Look, the right pulmonary surface. This right pulmonary surface, which is formed by the superior vena cava, inferior vena cava, and the right atrium. This is related to the mediastinal surface of the right lung. Then the heart is diverted toward the left. That's why this right margin of the right ventricle is not related to the right lung, and it does not contribute to the right pulmonary surface. Only this is the right pulmonary surface. This right pulmonary surface, which is formed by the superior and inferior vena cava and the right atrium, some people call also as the right margin or right border of the heart. Right margin of the same. And over here you can see this very clear-cut sulcus, which is called a sulcus terminale. And then from this, extending from this right coronary sulcus along the medial margin of the right side up to the apex, this is the right acute or inferior acute margin or inferior acute border of the heart. This is the inferior acute border of the heart. This one. This is the right margin, a right border. This is the inferior acute border, which extends from this coronary sulcus, and it is formed mostly by this right ventricle, and small part of it is formed by this left ventricle, and it leads to the apex of the heart. And then there is the left pulmonary surface, and the left pulmonary surface is very rounded, you can see it. And this left pulmonary surface is almost completely formed by this right ventricle, and a small part is being formed by this right auricle and right atrium. Okay, then the borders of the heart, again, this is the right border and right pulmonary surface, it is one and the same thing. And then this is the left border, left pulmonary surface, it is one and the same. And then the right or inferior acute border of the heart, which I have already explained. And then the left obtuse border, some people call it, it is the border which separates this sternocostal surface from this diaphragmatic surface, and or the sternocostal surface from this left pulmonary surface. It is over here a line, a rounded line, which extends over here from the coronary sulcus, left coronary sulcus, and descending downward to the apex, and this is being called as left obtuse border of the heart. Some people call this upper border as the superior border as well. This is all about the surfaces and borders of the heart, and I hope it will be clear to you. Thank you very much.